Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hard-working Americans and their families?
You will! This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefits in your benefit plan. Now prepare to learn,
Plan,
save,
and protect with the FIA Group.
Welcome to another episode of Empowering Plans with the FIA Group. My name is Cindy Merrell, and today I'm joined by attorney Bryan Dunton. Say hi, Bryan.
Hi, everybody.
So today we're going to talk about something that has been, it depends on who's in the White House, but it's always a consistent problem across the board. It's a bipartisan issue. I think most Americans can agree. Very long time, prescription drug prices have been at the top of the agenda for both parties. But today we're going to talk a little bit about what the Trump administration, his efforts, and what he is doing to address his idea of addressing the prescription drug issues. Bryan, why don't you tell us a little bit about what's happening right now? Every day I feel like something new is coming down. Yep. I mean, I think even when we were talking about the idea of today's podcast, I think from the time that we had created the idea, things had instantly changed. So, which is good news that things seem to be changing. But whether those changes are going to be effective, I don't know. But I'd like to talk to you a little bit more and pick your brain about what is going on right now.
Yeah, so a lot has happened since we first came up with the topic for this podcast. There's been a couple of executive orders from President Trump. There's been action at the state legislative level, which we're going to get into today, too. President Trump's also discussed for months now that he's considering imposing tariffs on imported prescription drugs. So that's something else to consider that we're going to do a deep dive into. But just to kind of reset and give some general background, like you said, this has been something that both Democrats and Republicans have focused on pretty heavily in their last several administrations. Trump's first term, he began working on restricting Medicare, limitations on them so they could negotiate better pricing. The Biden administration finalized that as part of the Inflation Reduction Act in 2022. So that's actually been happening now for a little bit. And the second Trump term is really seeking to expand upon those efforts and find other ways to increase transparency in pricing and get lower prices for Americans.
Yeah. And it seems that every day that there is a new facet to his approach. Yep. And it's ever changing, which is good because that, if we could be a little bit more nimble and address the issue, we can understand that. So there's been some executive orders that have been coming down, and it seems like every single week, every single day, we have some new executive orders. And why don't you fill us in on what are some of the most recent ones and specifically addressing prescription drugs?
Yep. So there's two. The first one was April 15th of this year. That one was designed to attempt to further reduce drug price negotiations by targeting PBM or pharmacy benefit manager practices specifically. The goal is to try and align with Medicare drug payments and hospital acquisition costs, and just enhancing the overall transparency, mandating disclosures of fees that are paid to brokers for steering employers to a particular PBM, things like that, trying to make the whole drug supply chain issue more transparent start to finish, and that would effectively reduce the PBM influence over the process as a whole. The second executive order was as recent as this Monday, May 12th, and that order from Trump attempts to reduce pharmaceutical prices for a range of 30 to 80%. He's got some pretty lofty goals in there, including setting price targets for drugs within the first 30 days from the date of the order, making it easier rather for direct-to-consumer sales to be a thing in the pharmaceutical world. And he's reinstated this policy he had from the first administration that he had about a most favored nation pricing model. So that's an attempt to get other countries basically to pay more for their pharmaceutical drugs, and he's hoping that the pharmaceutical companies themselves will respond in kind and lower the prices here stateside. Interesting side note on that: the U.S. has less than 5% of the world's population. Wow, I cannot say that word today. But we are responsible for about 75% of all global pharmaceutical profits. So,
which that figure alone is just astounding. So just to repeat for our listeners, that the U.S. subsidized, we pay 70%.
yes.
70% there. That's a huge staggering number. So I do understand the efforts to get that corrected, and that we are not bearing such a large burden for the global population.
Right. Yeah, that's exactly right. And this is going to affect everything. It's not just going to be Medicare and Medicaid, it's private insurance as well. And he's built some contingencies in place that he's alluded to in the executive order. If these pharmaceutical companies don't want to lower their prices, or there's resistance to doing so, he's talked about using possible rulemaking from the regulatory bodies to address that, trying to impact the way drug imports happen into the country, and even potentially using antitrust actions against the pharmaceutical companies.
Yeah, and that sounds, I like that it's a little bit more of a multifaceted approach instead of just a one-sided approach, and that's a little bit more encouraging. I think in the past, when he's tried some of these efforts, it's been more singular and not more comprehensive. So that at least it's a new approach, and it makes a little bit more sense on that one.
Yeah, it definitely does. It's great that he's trying to attack this from a bunch of different angles. It's honestly kind of refreshing to see such a new approach to this, especially when you talk about the fact that PBMs as a whole, there's 6 that control the majority of the market, and there's 3 that can jointly control about 80% of it. So even though we see consolidation in the self-funded world, as a whole, this is pretty remarkable, the concentration of power that exists with the PBMs right now.
Yeah, and PBMs have been a hot topic. I get a lot of the litigation alerts that are happening, and PBMs are they've been a hot topic for the last, I would say, even probably 4 or 5 years. So this has definitely been a long time coming. So I'm excited that at least there's some movement there. All right. And then one of the things I was thinking about is what President Trump is talking. He keeps talking about how these efforts are to benefit the American people, the American public, the consumer. And, they don't want insurance companies to necessarily be the singular beneficiary from this. Like, what does that mean for self-funded health plans?
So I think to make sure that Americans as a whole benefit from this, they want to make sure, like in the self-funded realm, people are the plan. They make up the entire plan. So any kind of savings that results from any of these policy changes gets passed right on to real people. It's not, it's not an insurance company that gets to line their pockets more. It's an actual individual that gets to keep access to good benefits, and they get them at a better price.
Yeah, and that's the thing that a lot of people that are not as familiar with the health benefits world, when they think of their health plan, they might not understand the intricacies that the savings that we are experiencing. It's not just, although yes, the goal, President Trump's goal is to lower the cost to the American consumer. It also, we are doing that on self-funded plans by bringing those savings to their health plans as well. So that's something that I don't want to get lost in translation with all of this when they're talking about who the target beneficiaries are on this.
Right.
Yeah. So the executive orders, do you foresee any new things coming on? Do you dust off your crystal ball before our podcast? Do you see anything else coming through as far as an executive order towards prescription drugs?
On the prescription drug side, I don't think I would see any more coming out for a little while now. I think he's going to give, the regulatory agencies that are involved in this time to actually propagate rulemaking to try and make make some of this actually be effective and come to life. So I think he wants to see what they can do first.
So we're keep talking about the multifaceted approach, and another approach that I think that we're going to talk about today is President Trump's efforts with imposing tariffs on prescription drugs. And while I was researching this, I was flabbergasted by some of the numbers out there that we're going to talk about here in just a moment. But will you tell us a little bit more about what tariffs, what proposed tariffs President Trump has been promulgating? I can't say that now either.
So President Trump, along with a lot of the tariffs that he's already imposed, he's considering adding one for pharmaceutical imports. And the goal has really been to boost domestic manufacturing of prescription drugs. What kind of numbers we're talking about, it's not really clear. It seems like his baseline typically tends to be about 10%. So I think we can reasonably expect that, but probably wouldn't be out of the realm of possibility to see something as high as like 20-25% for something like this. And there is good reason to want more domestic manufacturing of drugs here stateside. It could help adjust supply chain issues. Certainly, we saw some of that during the COVID-19 pandemic. We've seen it with those GLP-1 drugs like Ozempic, Wegovy. There was a shortage for a while. If some of that production is shifted here, then we're less susceptible to those kind of issues.
Yeah, and one thing when I was researching, I was shocked to find out that when we were talking about generic drugs, and that's really what drugs have probably have the highest impact on.
Yep.
And when I was researching this, over 90%, or at least 90%, of the generic drugs are manufactured. Their active ingredient is manufactured outside of the U.S., and that was really fascinating to me. As an American consumer myself, I didn't know that. It's fascinating, and when they were talking about the supply chain disruptions, and that's what you started to address. I know that just a little bit ago, just as another example, in an injectable, an IV, IVs were really in short supply in hospitals, and it was just scary to think that you could go into a hospital and not be able to get the drugs that you were looking for, right? And so I think about this like on a generic drug side. If my kid has an ear infection, I cannot imagine not being able to go get something, just go pop over to the pharmacy. And that's kind of one of the realities that could be if these go through. So the impact is real on those.
Yeah, the impact is very real with this.
Yeah, and it's to think about it when we go to the pharmacy. I think we kind of take it for granted. You could buy your top of the line name brand drug, or you can get the generic. And most of us, I would say, most commonly are choosing that generic. So it would have a huge impact.
Yep. It's very likely that if tariffs like this came into play, because those active ingredients are still sourced so largely overseas, that those are still going to be subject to the tariffs, even if domestic manufacturing occurs on a larger scale here. So cost savings from tariffs might be mitigated somewhat by that. And on top of that, shifting production, experts think, is going to take years. A lot of these facilities just don't exist stateside anymore. And for the ones that do, they're already geared up to design different medications currently. So expanding output in different ways, that takes time. And they think this is likely to take 5 to 10 years to materialize in a useful way for Americans to get their drugs more on the US side of things.
And in the meantime, what are some of the other impacts besides access to drugs, like potential shortages? Are there any other potential consequences that you see?
Yeah, I mean, when the shift starts to happen, you could see higher prices, in the form of increased premiums, higher out-of-pocket costs, just because you aren't able to source those drugs as easily, right? There could be stop-loss carrier considerations, right? They might adjust their premiums. They might make underwriting more difficult because of these challenges that are faced. That's always something you have to consider. I feel like smaller self-funded employers are probably more likely to feel the impacts of this first rather than larger ones. And PBMs wouldn't be exempt from this either, right? I mean, they're operating within certain margins. That's where they get their power to negotiate their rates. It's where they make their money. If tariffs are cutting into that, it's certainly going to affect how they sit at the negotiating table too.
And while there has been some more, this Trump administration continues to talk about tariffs, there's been actual new regulatory action that has been recent that a lot of states are coming into to try to address the outstanding prescription drug prices. Can you tell me a little bit more about what are some of the recent actions that have happened?
Yeah, so that's a really good question, because congressionally they've tried over the last few years to address pharmaceutical costs, perceived anti-competitive behavior from PBMs, and those have all largely stalled out. Arkansas, as recently as last month, took a pretty big swing at PBMs. Governor Sanders signed HB 1150 into law, and that effectively bans PBMs from holding a direct or indirect interest in a retail pharmacy within the state. So that extends to mail order pharmacies too, and specialty pharmacies. So effectively, if the PBM, like a CVS or United Healthcare, they all own pharmacies, they won't be able to operate those pharmacies in the state anymore. They would have to either divest themselves of them or take themselves out of the equation completely, because they won't be issued permits to operate in the state anymore. So that's pretty massive. And from an ERISA preemption perspective, this really gets around that because it's regulating PBM conduct. It's not regulating plan terminology at all.
Yeah, and it's definitely disruptive to the current status quo, which is, obviously a big impact. But there are some good things to that. So can you speak to that a little bit? Like, what are some of the benefits we might be able to see and expect out of that?
So I think there are a few good things. It could reduce conflicts of interest with PBMs. The Federal Trade Commission had a study that came out a few years ago that said historically PBMs tend to pay their own pharmacies higher rates than independent or small pharmacies. So it could cut through the heart of that, promote more fair competition. It may, in the long term, enhance patients' access to care, to those medications, because it's striking at that vertical integration nature of the PBM world. So there's a lot of goods to it. It certainly could also improve price transparency and reduce costs, but there's some setbacks to this too. There's certainly some consequences, at least in the short term, that people have to worry about too.
What are some of those consequences?
Well, for one, some of the PBMs have already said that if this law isn't repealed, they're going to pack up their bags and move out of state and take their pharmacies with them. That could be an idle threat. It might be reality. If it's real, that could really impact access to medications for residents in Arkansas, especially ones in those more rural settings where they already didn't have that many pharmacies to begin with. It definitely could lead to disruptions in service. For like mail order pharmacies, it could even lead to an increase in drug costs rather quickly, since now pharmacies are going to have to work much harder to source drugs, and there's going to be less of them to do that work.
Yeah, and what's happening in Arkansas is just one example, and there is a lot of momentum happening. I know that there's been every single, it feels like we're talking about all the things changing all the time, but there's been some additional legislation recently out of some other states. Will you speak to some of that? What else is happening?
Yeah, so there's been a lot of movement on this within the last few weeks. There's 39 state attorney generals that have signed a letter to Congress asking them to mirror that legislation that came out of Arkansas. Vermont, Texas, New York, they've already introduced nearly identical legislation to Arkansas. Even this week, Iowa filed Senate File 383, I think is the number on it. They sent that to Governor Kim Reynolds to sign into law, and that also would restrict PBMs slightly differently. That's really cutting at the reimbursement rates. Their hope is that if they can kind of equalize the levels that pharmacies are being reimbursed in the state of Iowa, that'll help prevent the closure of smaller pharmacies, because they've had an acute problem with that over the last few years. I think more than 200 have closed in recent years, and there were over 30 last year alone.
And I'm actually from Iowa, originally born and raised, and there's a lot of rural communities that already the patients access to pharmacies, and that sounds such like a basic idea to me.
Yep.
That we would have access to a pharmacy. Some of these people, they have to drive over an hour to their nearest pharmacy is over an hour, and sometimes they don't even know if they'll have whatever their prescription is there. And it's amazing to me. We're sitting here in 2025 and pharmacies are closing instead of, I understand the efforts of these lawmakers in trying to address this problem. And I will just have to see how this plays out. And I think when we were prepping for this, you had talked to me about a very recent, in the last 30 days, a new caucus within the Republican House. So tell me a little bit more about that.
Yeah, so the Republicans, a portion of the Republicans rather, in the House launched what they call the American-Made Medicines Caucus. So pretty lofty goals here. They're seeking some kind of tax incentives or regulatory relief for drug manufacturers that are based here in the U.S. They're hoping that if they do something like that, it'll promote production stateside and help mitigate those foreign supply chain issues we talked about earlier. So it's really interesting to see the interplay of this now with the executive orders that, in fact, the executive order that came out this week, and some of the other things we've seen play out recently, the discussion about tariffs. They're all very interconnected. So,
obviously most of our listeners are involved with health plans, self-funded health plans. What can some of these people do? What can we do about the ever-changing landscape? What are things that they can do also about the drug prices?
Well, I think as the sands shift beneath our feet right now, one of the easiest things to do is look over your contracts you have with your PBMs, look for any supply chain vulnerabilities you have now, see if there's a way to address those proactively, develop contingency plans for it. Perhaps that's focusing more on generics or some kind of therapeutic equivalent if there isn't a generic available. If there's patient assistance programs out there, those can help mitigate some kind of effects from it. Certainly, encouraging your PBMs to expand their relationships with manufacturers that are already over here in the United States, and even those that are international, that are subject to lower tariff rates now or would be after any kind of new tariff fee schedule comes out. Those are all things they can do. For me, I think the biggest thing is to remember that human element to this entire thing, working closely with your TPA and your PBM to make sure there's a continuity of care plan for your participants. Like that's key. Disruptions in access to medications can really have tragic consequences for people. So mitigating that as much as you can is as important as protecting price.
Well, thank you so much for joining us today, Bryan, because this has been really interesting to me. And I think that this is ever changing, and
Sure.
Bringing in I was trying to think of it. I was going to bring my magic 8-ball today, but unfortunately I forgot it at home. But I feel like that's kind of where we are. But at least I feel like there is momentum wherever that momentum is taking us. I don't know, but I am really excited about this. And thank you so much for all of your insights today. And once again, my name is Cindy Merrell. Thank you, Bryan. And we are together here for another episode of Empowering Plans with the FIA Group.